Welcome to Serenity Medical Health and Beauty Spa, conveniently located behind the Premium Outlet Mall in Dawsonville, Georgia. I'm Sharon Keating, RN, and we're here in the treatment room and we're discussing with a patient some filler procedures. Actually, a filler should really be called a volumizer. Years ago, when the fillers came out on the market, we just started, using the term filler. Really, what we're doing is we're replacing volume that has been lost through the process of aging. What happens is the fat in the face begins to shrink. The fat pads, which there's several of them on the face, they change shape, they shrink, they move around a little bit in this aging process. So the volumizers are designed to correct that. Today we are going to be using the volumizer Restylane, and Restylane is a perfect product to use in the eye area. Now Denise has been distressed a little bit by these deep grooves that she has under her eyes, and there's several fillers that can be used, but Restylane seems to be the filler or the volumizer of choice for that area. Now Denise is getting close to the point where in reality, for perfect correction, she really needs a surgery, but we're just going to try to give her a little bit of a pick-me-up today by filling in the deep tear troughs that she has. Restylane is a hyaluronic acid based gel formula that is it's an injectable, so it's just a little tiny injection. The result will last, depending on the person's depending on their metabolism, anywhere from 4 to 12 months even. These temporary products, even though they are temporary, they seem to have a tissue stimulating component to them, so she may receive some added benefit from that as well. But we're looking at least a 4 to 6 month, what we call full correction, if we're able to fully correct her today. We've just finished the volumizing under the eye procedure with Restylane on Denise, and as I stated before, she's actually a much better candidate for surgery. On a lot of people, I wouldn't even be able to attempt this, but she has a very large bony shelf, goes way up to under her eye. So there's a lot of things that go into the consideration factor if a patient is a good client, good candidate or not for this type of procedure. And typically, it's the tear trough here in this area we're addressing. We were able to just do a little bit more in the outer eye area just because the bone goes up so high. It did take quite a bit of product. We were looking at two 1 ml syringes of Restylane, so you just have to consider that in your budget. Now, we cannot do full correction because it's just the anatomy and the name of the game, but when you look at the before and after picture side by side, you'll see that definitely she's gained some improvement. And just for the rest of the shadowing that she has going on, I'm just going to apply a little concealer and just show you what a difference that will make as well. And this is Glow Minerals Natural, which works on most people, but it comes in, oh my goodness, 5 or 6 different shades. And can you look at me a little bit? This eye was much more prominent than the other eye, and that's not unusual. Our faces are asymmetrical to begin with, and then as we age, of course, the asymmetries, they each behave in their own genetic fashion. So anyway, so this is just this. I didn't even apply this really perfectly well, blending the way you normally would at home, but that just shows you that just helps to take care of a little bit of the shadowing that she had left over. So if you have any areas that need to be revolumized, we can help you out. The fillers are perfect for any area of the face. I have other videos that show you how we do the cheek lift to relieve pressure here off the marionette and the nasolabial fold area, and then we go back and fill that in afterwards. Fortunately for Denise, she's holding up really well, and her main concern was the eye area, which is called volume under the eye. So come visit us at Serenity Medical Health and Beauty Spa, and let's see what we can do for you.